Coronaviruses are a group of viruses that cause diseases in mammals, including humans and birds. In humans, the virus causes respiratory infections which are typically mild but in rare cases can be lethal. In cows and pigs they may cause diarrhea, while in chickens it can cause an upper respiratory disease. There are no vaccines or antiviral drugs that are approved for prevention or treatment. Coronaviruses are viruses in the subfamily Orthocoronavirus in the family Coronaviridae in the order Nidovirales. Coronaviruses are enveloped viruses with a positive sense single-stranded RNA genome and with a nucleocapsid of helical symmetry. The genomic size of coronaviruses ranges from approximately 26 to 32 kilobases, the largest for an RNA virus. The name coronavirus is derived from the Latin coronu and the Greek koron, garland, wreath, meaning crown or halo. This refers to the characteristic appearance of virions, the infective form of the virus, by electron microscopy, which have a fringe of large bulbous surface projections creating an image reminiscent of the royal crown or of the solar corona. This morphology is created by the viral spike as peplomers, which are proteins that populate the surface of the virus and determine host tropism. Proteins that contribute to the overall structure of all coronaviruses are the spike as, envelope, membrane M, and nucleocapsid N. In the specific case of the SARS coronavirus, see below. A defined receptor binding domain on S mediates the attachment of the virus to its cellular receptor, angiotensin converting enzyme 2-ACE2. Some coronaviruses, specifically the members of beta coronavirus subgroup A, also have a shorter spike-like protein called hemagglutinin esterase E. How to protect yourself? There are currently no vaccines available to protect you against human coronavirus infection. You may be able to reduce your risk of infection by doing the following. Wash your hands often with soap and water for at least 20 seconds. Avoid touching your eyes, nose, or mouth with unwashed hands. Avoid close contact with people who are sick. For information about hand washing, see CDC's Clean Hands Save Lives. How to protect others? If you have cold-like symptoms, you can help protect others by doing the following. Stay home while you are sick. Avoid close contact with others. Cover your mouth and nose with a tissue when you cough or sneeze. Then throw the tissue in the trash and wash your hands clean and disinfect objects and surfaces. Treatment. There are no specific treatments for illnesses caused by human coronaviruses. Most people with common human coronavirus illness will recover on their own. However, you can do some things to relieve your symptoms. Take pain and fever medications. Caution. Do not give aspirin to children. Use a room humidifier or take a hot shower to help ease a sore throat and cough. If you are mildly sick, you should drink plenty of liquids. Stay home and rest. If you are concerned about your symptoms, you should see your healthcare provider.